Maternal and Child Health. Dr. Tilak Sirivardhana, Deputy Director General, Environment and Occupational Health and Food Safety. Mrs. N.M.Y. Tushari, Commissioner of Labour, Women's and Children's Affairs Division. Mrs. Riaza Ahmad, Chief Legal Officer, Ministry of Health. Dr. Nigel Rollins, WHO Headquarters, Switzerland. Professor Pujita Vikramasinghe, Vice President, Sri Lanka College of Pediatricians. Dr. Abnu Daniel, Health and Nutrition Manager, UNICEF Sri Lanka Country Office. Mrs. Menu De Silva, President, Sarvodaya Shramadana Women's Movement. This panel discussion, today I am honored to introduce Dr. Susie Pereira, who will be moderating this panel discussion. Dr. Susie Pereira is a specialist in community medicine and is well known to all of us for her commitment to uplifting the health status of the country and as a public health expert who has contributed to public health policy development and taken leadership in primary care and organization reforms in the Sri Lankan public sector. Dr. Pereira is currently the Deputy Director General, Public Health Services 2 of the Ministry of Health. Several national health programs come under the purview of this role, including the Directorates of Maternal and Child Health, Nutrition, Estate and Urban Health, and Health Promotion. Madam, please take a seat at the head table. Over to you, Madam.
I think we have come to a very interesting point where we're going to hear so many views of so many of our panelists. Let's see how we can handle this. Okay. And let me first start with Dr. Chitramani, who is the Director of Maternal and Child Health. And I'll be asking actually a question from each of you. And let's see how we could respond in today's context that we've been understanding how it applies to Sri Lanka. So what more can be done to promote and support breastfeeding through the MCH group? How do you see it?
Thank you, Madam Chair, for the question. I would say now we have achieved a lot on breastfeeding through our MCH program, but we saw there are a lot of things to improve, like in the legal system and also the marketing field. So there are things that we have to strengthen our mothers to resist the pressure from the external influencers and also our health staff. So I don't know whether our grassroots health workers are strong enough to counteract the influence of the industry, especially our public health midwives. So that they should change their training, or whether we should include them in another special kind of approach, how to tackle the influences from other sectors. And also I have seen like there are some groups which are not approaching our system, like maybe in cities, we were talking earlier also, there are groups who are not reaching our system, the public health system or the government hospitals, the private sector, reaching the private sector now. So therefore we have to have a system to reach them. I don't know whether it is through one-to-one physical contact, but at least maybe through social media or any other means, we have to get them educated about, I think, what Nigel was saying today. So there are so many things that we learn from him, and that has to be given back to our community. The milk insufficiency had been the major drawback which attracts the industry. So that has to be our health staff or even our lactation management centers, and those things have to be strengthened more to address the milk insufficiency as well. And we need to, from the Ministry of Health, we have to lobby for maternity benefits. There are some gaps, those gaps have to be addressed. And also the legal system, we have to advocate for changes in the legal system, either breastfeeding code or act or whatever the new things come in. So that has to be forward by the Ministry of Health. And also other observation in the WTI is this bottle feeding rates in Sri Lanka is high. Although the breastfeeding rates are high, the bottle feeding is also, to some extent, it was high, about 30%. So that means even the breast milk, sometimes they use the bottle to feed the breast milk. So that need to be addressed again through our public health staff. The expression and cup feeding and all that has to be again strengthened, and the special emphasis should be for working mothers, to target them at the age of 4 months, what are their plans, and there has to be very close contact with the public health team to address the issues of the mothers who are going to work. So, and also the urban sector, as I said before, that has to be approached, and also to dispel the myths and the beliefs that the mothers and the families, and especially the parents and the grandparents or the in-laws are having. So those has to be addressed through our public health team. So we need to strengthen them. We need to address the curative sector as well, and to strengthen them more and more on the new things and what is happening in the other countries, the international arena. We have to take some examples from those and educate our public health system to address the current challenges.
So you do see that the current MCH program requires further strengthening, especially in the context that we as professionals, we think of the very rational approach, but there's an emotional side which needs also to be addressed through appropriate messaging, which can counter the industry side also. Let me just move to Professor Pujita Wickramasinghe. He is the president of the, vice president of the Ceylon, the Sri Lanka College of Pediatricians. Now, as the professional college, which is responsible for the health and nutrition of children, and as a body that has had a long history of supporting healthy breastfeeding policies in our country. Can you explain briefly like how we would motivate the present membership to protect breastfeeding?
Actually, Madam, I think College of Pediatrics on Pediatric Association was one of the most organizations that helped in bringing the breastfeeding code and also establishing the standard norms for breastfeeding. I think a long way they have come, and it's actually in the translation and sort of keeping the your membership and updating them the newer aspects of breastfeeding. So what basically done is actually all participating actively in policy formulating in the ministry at that level. They are contributing to a great extent. And through that, whatever policies that are being developed are being translated and being communicated to the membership and keeping them important on that side. And also at the sessions, of course, and other scientific fora, that all the updated knowledge will be communicated. So I think that is the main way of sort of keeping the importance as well as updating and encouraging them and sort of moving them in that direction. Because when it comes to professionals, you can't put very much of boundaries and say. So the professional freedom is always there, but on top of that, the correct facts have been laid in front of them in a periodic manner in order to make the most suitable best decision for them in order to foster breastfeeding as well as timely other follow actually the high value of guideline as a whole.
Professor Vikramasinghe, Dr. Nigel Rollins did mention that although the professionals are educated about the challenges posed and how they should promote breastfeeding, is there something extra that the professional college
Always,
such as yours can do?
I think always there is always room for improvement. So as a college, I think this can be taken up as more of a fairly frequent event and more wider all sectors of the all corners of the country. So I think that would be the main way of doing that as well as to improve and sort of have a sort of a dialogue between, because sometimes there may be other reasons which they would see that has to be discussed with them, and then strengthening the training, that would be the best way I think, because sometimes we have to sort of make a big open dialogue as well as always, I think, because when it comes sometimes with, as I personally also said, there's always pressures, always. They are also human beings. We don't know. So it's always at all levels. It has to be communicated as well as I think messages have to be repeated. And for that I think close dialogue, frequent dialogue is always.
I think it's a very close decision between what you know and what you practice. So there's a constant nudging that is needed amongst the professionals within your body. And I would like to invite our Chief Legal Officer, Mrs. Riyaza Ahmed, to give her thoughts on what you think the legal provisions that are there for protecting breastfeeding can be strengthened. How do you think our legal framework can be strengthened further?
We know that existing provisions are under the Consumer Affairs Authority. It's a directive. So directives are like regulations. So it's been gazetted and that is in place now. And it is a very it's a very wide regulation or a document. It covers the protection to a certain extent, But what now we have, we are in the process of amending it, and as well as to go for the new system, like what we have already experiencing is the law enforcement is with other agencies, as correctly mentioned by Dr. Hiranya, and we are the monitoring and the advisory committee. The monitoring committee is within the health sector. So we were all this time, even though there is a what I can say, it's the prosecution part is not taking place, but we were like a watchdog, and always there were, whenever the violations are spotted and informed, we write back to them with a strong letter from the DGHS, and we kept them in a line. I think that you should appreciate that type of a work, at least because we are keeping them under control, I think. But we have to go for a law, because now from what we learned today, the marking, the point scheme and everything, it reconfirms that we should go for a new system, and our efforts of amending the existing one and the proposed ones, most of the things we have covered, but there is still room for us to go for polish this with the advocacy and assistance. Thank you.
Now, Mrs. Ahmed, like you have been in the health industry for a long time, in fact, 1997, and you have been actually engaged in even preparing initial drafts of what you just mentioned. And do you see that the new legislature would really help in taking action against those who would be violating this? Because there must be some difference that needs to be taken into account.
Yeah, I think because there are two aspects now. We are dealing with our healthcare workers and the industry. So
Do you think that there will be some change?
We need the change, and it's been addressed.
So I would like to now invite Dr. Sirival, who is the Deputy General for Environment and Occupational Health and Food Safety. And he is the head of the Food Control Administration Unit of the Ministry of Health. He is the focal point for implementation of the Food Act under the Director General of Health Services. So, can you explain how the provisions under the Food Act actually can support and protect breastfeeding?
Thank you. So I think yes, the Food Act of Sri Lanka, which is very old, about 40 years old now, 1980, but it has provisions to modernize or make necessary changes to relevant regulations, because the Food Act say doesn't work, but it needs, we call that, we need teeth to bite. The regulations will give the teeth to bite. The regulations we can change very frequently. It is not a difficult task. As the Chief Legal Officer said, the Consumer Affairs Authority have some sort of control on the breastfeeding alternative regulations, because we are not going to regulate the breastfeeding, we are going to regulate the formulas, infant formulas or substitutes. That's how we are going to improve the breastfeeding in the country. So up to now, the Food Act was mainly focused on the, up to recent time, it was focused mainly on the safety of food. So actually we want to ensure to make sure that food available in the market are fit for human consumption. But we have gone beyond that, and the new regulation gazetted already, which was number 2319/40, which was gazetted on 2023 February 14th. It clearly says about the breastfeeding substitutes. At one place, if you go over the main points, this is the point number 13, paragraph 13-16. It says clearly, the person shall not advertise infant formula, between brackets starter, infant formula between brackets follow on, any other food products for infants or milk and milk-based products for young children. That's clearly said. And further, it says in some other places, some other place called it's number 12. It says that no label or advertisement related to any article of food shall contain false claim or misleading description. And 2 says, no food shall be described or presented in a manner that is false, misleading or deceptive or is likely to create an erroneous impression regarding the character of any respect. That's how. And as said earlier, under 17th of 13th paragraph, it says, a person shall not advertise in a product, label, print, electronic media, social media, or any other means, any advertisement, audiovisual or a pictorial representation, either directly or indirectly, that case of a pregnant or lactating mother, an infant or child under the age of 12 years in relation to food. And it goes further and says, a person shall not promote any food directly or indirectly to children under 12 years of age by way of advertisement, leaflets, pre-samples, articles or toys, and so and so. So the food that we can have regulations. This regulation is not not a big new system, but within the system we have gone that far to control the infant formulas to improve the breastfeeding in the country. But the industry, their projection is increase of 4.6% baby milk and infant formula market. Baby milk and infant formula market increase of 4.7%, 6% per year during 2023 and 2028. That's the target of the industry. So they may have something their projections. So we may have to do a lot more to control the inclusion of other things instead of breastfeeding.
Thank you, Dr. Sirivalan. What you mentioned is about the regulations that can be brought under the Food Act to further protect the breastfeeding through some controls that you are putting through the advertisement side. Let me next invite Mrs. Tushari, the Commissioner of Labour, Women's and Children's Affairs Division of the Labour Secretariat. She has 27 years experience in the government service, including 13 years in the Labour Department. And with your experience, what are the existing maternity benefits? And are there any plans to strengthen? Today we have talked a lot about working mothers. years.
There are two enactments and also there are amendments and regulations in our department. They consist maternity benefit, leave entitlement, also monetary benefits, provisions of nursing intervals, legal protection before and after confinement to woman worker and her child, safeguarding physical and mental health, tech facilities for children under 5 years. These are only covered private sector and semi-government sector. Main idea. Also, there are special provisions include nursing intervals. They provide 2 intervals per day, of which each interval is not less than 1 hour if no crèche or suitable place is provided for breastfeeding. Also 2 intervals per day, of which each interval is not less than half hour if crèche or suitable place is provided for breastfeeding. This is provided until child is 1 year old. There are same provisions, amendment amendment 2018 number 15 and maternity benefit ordinance 13 of 1978 amendment. These provisions are minimum requirement that should be provided by the employer, and those can be expanded for increasing welfare of women workers. The private sector and also metric benefits for public employees as per the establishment code chapter 12, 18 and for 2005 circular. This is decided according to the chapter 12 establishment code. Female officers, whether permanent, temporary, casual or trainee, are entitled to maternity leave. Female officers are entitled to 84 working days full pay leave in respect of every live childbirth, and they will not be allowed to resume duty before expiry of 4 weeks after the birth of the child.
In your opinion, do you think that we are covering all types of working breastfeeding, or have we left out?
Yes, private sector, all casual and all workers are covering this.
So you say that the legal framework is adequate in terms of working women.
Except informal sector. Informal sector is not covered anywhere. It's a very difficult area to capture.
Yes, we can't find informal sector. Formal sector also.
And also mothers are asking for 126 days. I'm from, sorry to interrupt you, but I think this is an appropriate moment because we have just, the Scaling Up Nutrition People's Forum has undertaken a study in the free trade zones and the plantation sector. We are very happy that breastfeeding has not really conventionally got destroyed, but the same problems remain of old. And that is 84 days, especially in the private sector, will not make it possible to have 6 months exclusive breastfeeding. And I think with due respect to Dr. Rollins, still the formula companies are creeping through the lack of leave entitlement for mothers, because what are they to do?
Private sector had 84 days entitlement of leave, but nursery breastfeeding 1 year, extend 1 year.
Yeah, but for private sector is 84 days and they don't have the option of half pay and no pay still. So what do you do with the remaining 2 months? They are reluctant to express will, and if not, they have to go to formula.
I think we'll come to this. This is a very interesting discussion. But we'll first allow the panelists to make their comments.
Susie, the reason I came in is because it's taking a long time and we don't really know at the end whether we can. Sorry for interrupting.
No,
but this
I
had to
think
be said.
this-
Sorry, I
this
will not
is,
speak
This is
again.
an additional question that I posed because I wanted to it come out, right? So we will definitely take it up. I would like to now invite Venu Silva. She is the president and of the Women's Movement for Samoa National Garment. And as a focal point for also the fund Sri Lanka, how do you see the protection and promotion and support of breastfeeding?
Thank you, madam. Yes, Sarodya Women's Movement is women's empowerment arm of Sarodya Movement, which we are working, giving our services to covering all 25 administrative districts, and also we are engaging with most marginalized communities. Basically, as a focal point of IPFAN, basically we are doing community kept up to date about the importance of the breastfeeding and find opportunities to promote it within our framework, and also under the Sarodya movement we have more than 300 mother support groups around the district, around the country. Within these mother support groups, we are reaching to them to giving the advocacy and training about the importance of the breastfeeding. And also, we are working with different cultures, with the different women in different culture. We are sensitively educate them about the traditions and that the impacts of the breastfeeding, how we can, because different culture is giving a different feedbacks for the women who are doing breastfeeding. So that's the main thing what we identify. And also we will look into the women that we respect the needs of the mothers who choose not to be doing breastfeeding. So we are sensitively engaging with them, and we will giving awareness trainings for change their mindsets, and also we are giving the importance of the, we are giving them what is the importance of the breastfeeding, and as well as the cost and the risk of the non-breastfeeding. So these are the main activities we are focusing to support, protect and promote breastfeeding with the most marginalized women in all 25 administrative districts.
Thank you. I would like to ask a similar question as an organization working at the grassroots level. Is the mothers who are informal sector, who are marginalized also, you said you are reaching out to the marginalized. Do you see like a special ability for you all to actually work with the informal sector? Or is it the non-working?
It's a non-working mother especially, but in some other hands we are also working with the working mothers. as Visaka mentioned, that we also working with the mothers in the free trade zones. So they are having a different problems and different aspects within the same thing, with the working with these type of women as well as the most marginalized women in the rural areas.
Thank you. Because the concern is coming up from different people in the audience that there is a group that the formal sector, our program is sometimes not reaching, and we are finding it difficult to reach. I think this came up. So it's good to know if there are grassroots level organizations who can reach and try to change the attitudes of this, who can resist the pressures from the commercial sector as well. So let us move on to Dr. Agna Daniel from the UNICEF. And I think UNICEF has been working very closely with the breastfeeding program in Sri Lanka for many years. And in the current context, when child nutrition is challenged on many fronts, as UNICEF, how do you plan to invest in or support the breastfeeding program in Sri Lanka?
Right, thanks so much, Dr. Susie, for the question. And clearly, as you rightly said, the kind of challenges that the country is currently facing, it's extremely important for us, all of us, to not only continue to promote, support and protect breastfeeding even now, but to promote, support and protect breastfeeding especially now. The kind of challenges that the families and the added pressures that the families would be currently facing, I think there is a lot more on us to proactively support and protect breastfeeding in these current times. As UNICEF, traditionally, we have always worked very closely with the Ministry of Health, with the Family Health Bureau, and be it areas around capacity building, be it areas around developing online resource package for training, or helping facilities upgrade their standards to provide quality assured care. So these are the general areas in which traditionally UNICEF has been working. And we also always advocate with the government to ensure all the protection mechanisms for breastfeeding are in place. The recent example being the update of the code, for which we, at the regional office, we did the assessment of the different laws in different countries. So we use these kind of actions to try and advocate for the same. However, given today's event and given our interaction with Dr. Nigel that has happened over the last 2-3 days, I think it's extremely important for all of us to think about maybe a IYCF 2.0 program in Sri Lanka, which not only strengthens the existing provisions, the existing protection mechanisms that we have, maternity protection, parental leaves, workplace support, safe spaces for breastfeeding. Apart from that, we can also closely look at and strategize in terms of what are the commercial determinants, as Dr. Nigel pointed out, and what could be our proactive strategies that we can come up in order to try and address this particular trend. Clearly, I think the upgraded legislation that is in the making would be extremely important, and we need to continue to advocate and push for it. But at the same time, how do we enforce it? And also, how do we further strengthen and accelerate and proactively take measures so that we can address this particular challenge? And I think, just to conclude, I think from UNICEF side, we are proud of the fact that we try and be as flexible as possible in our support. So any kind of evolving needs that come up, I think not only UNICEF but even other UN organizations and development partners can step up and try and support in the updated asks that the ministry would have.
Thank you very much for that final statement of flexibility and also because I think what we came up, what I'm hearing from all these discussions is really that this communication part of the MCH program needs further articulation into analyzing this the emotional part, because we have not addressed it. We went on the rational part, and now we need to package our interventions along that line as well, and also about the council, because we need to be sensitive to the need for the moment, whether we have that kind of a counseling system to support breastfeeding. We have to really see that. So maybe we need to do some ground level investigations also. And I'm very happy that UNICEF and also I think the audience is WHO. I mean, we have to work together to understand this. So I think we've heard a lot from Dr. Nigel Rollins, but nothing is too much from you. So, as concluding, like, what more should Sri Lanka do to protect breastfeeding in terms of legal issues?
I have to say, everything that has been shared and suggested is really good to hear. I think the commitment, and I think just the discussion on the informal economy is absolutely critical. It's a large number of women, and it's a very complex issue to think about how can you extend maternity protection to a population that is hard to actually reach. So I think that's true. I think in terms of hearing about the new legislation that's going to be implemented in January, and also the new legislation that's being drafted, I suppose probably the greatest challenge of all is how do you bring into that really meaningful sanctions, because sending letters to tell people to stop doing something is important, but it's hard to think that those by themselves are going to deter action, which is so important for their shareholders. I guess the one big thing that I would say is that, because everything else that has been described is essential, I think the highest level of political support, visibly saying it, and across government, so it's very good to see, colleagues here from the legal sector, etc., but to have the highest level political support for all of this, I think is really essential. And I would say the same actually for the health professionals. To see the health professional associations in Sri Lanka really showing that leadership. I think it is that political leadership, whether at a government level or at a health professional level. I think that is the element where there's opportunity still. I think there's so many other things happening in legislation, this and that, but unless you have the leadership, then it's not there. And some people have even been saying, kind of an all-of-government approach, that every sector, trade, there should be, within government performance, that breastfeeding rates should be a performance metric for all sectors. For labour, they have a role in breastfeeding. Trade has a role in breastfeeding. Health obviously has a role in breastfeeding. Finance has a role in breastfeeding. And to see breastfeeding rates as being a metric for all parts of government would be a really interesting area to explore. But it has been an absolute privilege to be here in these discussions. So I must say I thank everybody for sitting and spending this time, but more so to the commitment and the action that's been happening before, and I trust will happen in the future. Thank you.
Thank you very much, Dr. Rollins. I think we will have comments from the floor, Vera and comments, and you can direct it to any of the panelists. Yes,
I think from a professional's point of view, especially these associations, once a year we conduct these activities and we need some sort of support. So I can't blame, getting money from somewhere, right? But at the same time, I have to say at this stage, College of Pediatricians are doing a very, very dedicated service for promoting breastfeeding and doing everything possible. So I don't want anybody to, I made a comment earlier, but I would, it's a recorrection because media is here, they can take my comments out of context and say that Dr. Ramya is, that sort of thing, As a past president of the college, I'm telling everybody that we are doing everything possible, right? This, the code of breastfeeding has to be strengthened. That's the only thing I want to say that, because we debated about it in length, and what we found out was that, still, if you read the code properly, you can get sponsorships. So first thing what we have to do is that we have to strengthen the code. It's very important. Yeah. But my comment is that the College of Pediatricians are always, I've been a consultant for more than 30 years, and I can vouch to say that we have, all of us, have gone out of the way to help this. So should not quote me wrongly.
But I said students are well taken.
Yeah. Because when you conduct, we need to get people from overseas. It goes into millions, right? So government is not supporting us at all. Right? It's the same for all the colleges, but all the colleges are doing a marvelous job, and especially College of Pediatricians for promoting breastfeeding.
Dr. Susie, may I, with your permission, ask a question from the Labour public official? Madam, you spoke about the 84 days leave and all the PANA and TUA and things like that. But have you all re-looked at that plan? Because now, say for a mother who's coming from Makara, 1 hour is not enough for her to go back and feed her baby. And also creches, workplace creches where they can bring their babies and keep their babies, so that they are sure that the babies are looked after. Are you looking at those aspects as well? Because I think the public sector can the private sector can well afford it, and the plantation sector should be made to do it. Are you looking at the different sectors? Sometimes I don't see a cohesive whole. We do a lot of things. It's not a critique. I mean, all people are doing a lot of stuff, and it's very good. That's why our health system is fantastic. But are we looking at the nitty-gritty and thinking 84 days, does it cover 6 months like what Visakha was saying? So what's the point in giving 84 days if that initial 6 months of breastfeeding is not covered? What's the point? I think we need to look at the detail. And we have very qualified technical people. Y'all are doing good work. But look at the detail and help the mothers of Sri Lanka.
Point taken. We will look into the details of this. It's high time. Yeah. In the estate sector, if anyone wants to elaborate what exactly is happening now, please. Can somebody update us on the estate sector? Yeah, Sashila.
Yes, the estate sector. This 84 days of maternity leave is already in place, but it's as usual. It's happening as the private sector. But as the journalist asked, there are 1,200, I think, nearly 1,200 creches, child development centers with the breastfeeding corners. So they have some facility to facilitate the breastfeeding during the working hours after the maternity leave. Thank you.
there any mechanism that you're monitoring the satisfaction of the mothers, whether these breastfeeding corners are actually helping them to support breastfeeding, or is it just that we have put in numbers and saying that we have the numbers? We have to see it from the client perspective or from the mother's perspective.
It was not a very structured monitoring, but on-site monitoring and inspection and discussions with the mothers revealed that they are utilizing the breastfeeding corners, and during the I think up to 1 year of the infancy, the mothers are given the plugging areas closer to child development centers, and every 3 hours or 2 hours like they have been promoted by the estate management to go and feed the child. So it happens, from the focus group discussions and interviews with the mothers as well as the estate management, this has been revealed, but it's not, I can't say it is as just few visits, from the few visits we made and the interviews.
Dr. Sashila, it would be very good to know what percentage are actually using these breastfeeding corners, as well as interview some of the ones who are not using to see why they're not using. That would make the effort more concentrated.
Thank you, it's noted.
And also, is there an overlap between, the medical people are saying 6 months exclusive breastfeeding. So are we giving them 6 months to be with the baby? Those are the things we need to look at and address.
Yes, 84 days they have been given as a maternity leave.
But does it work to 6 months? Does it work to 6 months? 4 months? Then it doesn't
No, 4 months. But after that, when they work, they have been given break to go and feed the child in the breastfeeding corner.
But if the child cries, someone is going to give something else.
Demand feeding cannot
So
be
what
done.
I suggest is that the Directorate of Estate and Urban Health looks at this with this feedback, because this feedback is very important, and try to see how it can be improved further, and whether the legislative framework is adequate to support the plantation sector.
Okay.
I think we have Dr. Nishani Lucas. Yeah, please.
Hi, I'm Dr. Nishani Lucas, neonatologist and lactation consultant. I just wanted to add a few things. Thank you very much for the very informative lecture, and especially the inputs as to how the marketing is sort of influencing us. Just if I can answer your question about 84 days, I think there were 2 questions. So at the moment, I agree 84 days is, so I'm a clinician and I help moms. So 84 days actually comes to 4 months, sometimes 3.5 months, depending on how it's calculated, because it's 84 working days and it depends on how your company or wherever you are. If you're not in the Ministry of Health, I'm in the Ministry of Higher Education, 84 days for me too. So it happened to me as well. So anyhow, exclusive breastfeeding is sort of recommended for 6 months, but there is also a clause that after the completion of 4 months, I mean, especially for growth faltering and stuff like that, but if it comes to work issues as well, instead of starting formula milk, because you raised the question, I thought I'll start with that. There is a possibility of starting complementary feeding, but actually, to be fair, I don't think this message is going across to the community very well, because in the technical updates we had like about a week or 2 ago, also in lieu of breastfeeding week, this question is being asked again and again. So I think it's important until such time, if we are going to make it 6 months, fantastic. Until such time, I think it's really important that everybody knows about this, because what happens is it's in the mind of everybody that 6 months exclusively breastfeeding, but it's also milk feeding. So therefore, if people have to stop, my own mother actually asked me to start on formula milk because I had to go back to work at 84 days. So people think it's some sort of milk. So what happens is grandma comes with sort of a formula milk from the beginning, saying, I have to look after the baby. You're going to be gone. So let's start formula milk feeding from the very beginning. And also that is one. So I think that message we are saying, and we teach actually to the midwives, but it may be going in too late. And planning when going back for work is very important, rather than coming 2 days back and saying, I'm going to work in 2 days' time. I think, again, from the midwife's point of view, we do address this, but some more, it needs to be planned. They have to come at least maybe 2 weeks earlier to teach the expression of breast milk, or starting the complementary feeding needs to be done by the mom. Then it can be given over to the grandmom or the sister or the whoever else who's going to take care. So because that fails there. If you leave it to the mom, and it has to be individualized. So we are giving like a group option, but it doesn't work for everybody, because my working circumstances, the way I travel, the way I come home, what I do is different from somebody else. So I think that's one thing for the health sector, and as well as to you, and also I think from our training programs point, because I think Nigel spoke about infant behavior, and I've been speaking about it a lot too, because especially from the pediatricians, one of the things that we fight about is that they say breastfeeding, breastfeeding, breastfeeding all the time, and the child doesn't eat. So that is all. There are lots of behavioral things about it, and also this crying, all that. So I think it's important to give, consoling strategies, sleeping strategies. We don't really train our moms how to sort of, deal with a sleeping child. What do you do with a cranky child? So they offer the breast, and that's why all these stories about O-level children having breast milk still. So I've been asked that in forums. So do you recommend breastfeeding, because you go around saying breastfeeding is good for everything? So that we need to separate, the breastfeeding is for the baby's part of thing, and the behavioral aspects need to be separated from that. And again, I think there was another question about the women in the city, especially our, people, our circles, maybe doctors, professionals. We don't, because I work only in the state sector, we don't see that group of people a lot. And it's very hard, the messages we give from the public health midwives don't really go to them, because especially in Colombo, I have never seen a public health midwife in my setting either. So I'm not blaming it, it's our fault as well, because the city people don't welcome the public health midwife, especially in the sort of urban area. And we see in a lot of social group medias, many of my colleagues forward it to me, where doctors themselves are promoting formula milk, because, as Nigel said, my child is cranky, my child is sleeping, so we don't know whether the actual people or whether it is the formula industry itself putting this post. So I think it's time, sort of, we as the Ministry of Health also get involved in sort of, we should also have our own groups, and we should respond to people very quickly, because I did a study for 2 years, and we have to give a hotline and respond immediately. Otherwise, 2-3 days they go to the wrong person, they are prescribed formula milk. When they come back, it takes hours and hours of counseling to get them back. So there may be little things. So even the breastfeeding counseling needs to be individualized. They should have maybe a hotline or immediate access to somebody. And we can also, I think, suggest to use things like Facebook, Instagram, all these things, so that we have our own groups and give the right advice, because there are so many forums giving wrong advice. Thank you.
Can I just thank you very much, Nishani. I think it's very important that you clarified these things, because this time the breastfeeding week theme is also supporting the working mother. So in addition to all what Nishani said, to be fair, I think for the working mothers, Family Health Bureau has developed a little booklet. The authors are all sitting there. රැකියාවට යන මවට මව්කිරි දීමට සහාය වෙන්න කියලා. So that booklet is there, because media is also here. I think we should clarify it. And also for the working mother, the midwife actually, as you said, individual, the guidance given to the midwife is to start individual training at 42 days. There is a visit by the midwife to the mother at 42 days. So at that visit, it is her responsibility to discuss with the family, not only the mother, the father, and especially the grandmother is recommended to be included. So I think that's there, but there are lots of things, as Nishani and many others pointed out, that we need to strengthen. So I think you did not go away with the idea that there are lots of things which need to be strengthened. And also, I think they are trained on, as Nishani said, somebody can take a decision to, I think we recommend that the decision to start complementary feeding, if necessary at 4 months, to be started by somebody responsible, not the midwife alone. But what we recommend the midwife is to educate and train the mother to provide express breast milk. So I know.
That doesn't always work, especially
Yeah, I know.
when the mom
So
is
it would.
far away. That's why.
Yes, that's the thing. So the decision, we feel, I think what we educate is at least to be taken by the MOH or a pediatrician to start complementary feeding at 4 months, because it's not a blanket guidance that is given to start complementary feeding at 4 months, because I think we believe in breastfeeding for 6 months is exclusive breastfeeding is I think what is government is promoting. And there are many mothers. I worked 40 kilometers away and I breastfed exclusively for 6 months. So I think but I think that's why it has to be discussed with the family. The father, how the father can support. Sometimes the father brings the baby to the workplace. So there are lots of things the families very nicely work out when we discuss with them. So I think I fully agree. It has to be an individual plan. Thank you.
Biologically, Dhammika, is it 6 months exclusive or it's a get out clause at 4 months?
Yes.
What is it?
I mean,
that should be clarified.
I think
lactation is it a get out clause or is it really 6 months exclusive? Because then we could have stayed at 4 months.
Yeah,
No.
The thing is, it's 6 months. Then we can't dilly-dally on it.
Exactly.
People don't understand.
So we don't understand.
And there is another, before you answer that, I have one more point, right? Now we talk about, there was never any word said about the midwife. They are fantastic. You know, the way they go from house to house, the way they, but I'm talking about the people who have fallen through the system, the city mothers. So why can't we have a health ministry, private sector, private hospital, something, no? Why can't we get them to inform the public health system that so many mothers are getting their babies in the private sector? We have a very good system.
I'm sorry, if you go to the private sector, you will see very tiny bottles in the room.
Everywhere.
Yeah, I'm doing this regular, visiting the private hospital. Sorry to say.
Do we have anyone from the municipality?
Tiny bottles are there in all the rooms.
Most of the mothers who are in the city, who are working, this is somewhat difficult to feed. Actually, they are very poor people. Others, normally they give 6 months breastfeeding. The main problem is, especially in the private sector, those affordable people, those who are going to the private sector, they are not giving breast milk. If they are having any problem when they go to the private sector, most of the pediatricians used to advise to start the formula feeds. That's one of the main problems that we are facing.
Can you, for the benefit of everyone else here, just describe the public health system when there is the midwife and so can you just explain?
In the city of Colombo, actually we have.
There is a difference between the other areas. And
City of Colombo, we have 100 midwives who are working from Colombo 1 to 15. They're covering all the area. So they used to go to the field with the mothers. They are registering the antenatal mothers in the clinic, in the field as well as in the clinics. So during the antenatal period, we are conducting sessions, antenatal sessions, and ECCB program. With all those things, we are explaining the mothers about the necessity of the breast milk and the value of the breast milk. Normally, most of the antenatal sessions, both couples used to come, and most of the mothers are there. They know the value of the. And the other thing,
average population per midwife?
Per midwife in between 5,000 to 6,000. And the other thing, actually, from the antenatal sessions as well as the health education programs, which gives before the starting the clinic also, we are explaining about those things. So most of the mothers, they are taking the advice. The thing is that those who are having the feeding problems. So even normally within 5 days the home visit is less, but within 10 days, normally more than 70% of the midwives are going. Mothers are covering for the postnatal visits. So they are also, we are checking whether they are giving the breast milk properly.
So the municipality does have a very mixed population, right? So that's what Hopuni is also telling. We have to analyze it in depth because it's quite a large population that we have in the municipality areas. And although there is the public health midwife, the same similar kind of a system, we need to really see how effective it is. And even in the other areas where there is urbanization happening, and there would be resistance or reluctance on both parties, midwife as well as the community, to actually get the services of the midwife. So these things are there, but by far and large, I think the MCH program has done remarkably well, but needs to preserve the current challenges, and the legislation needs to support now the number of days that they could continue to breastfeed, as well as these hotlines. Now, if we are talking about hotlines, actually, for every mother registered with a midwife, the midwife is really the hotline. Whether that is adequate for this kind of support, or whether the midwife actually needs a different kind of skill to be counseling, these are the things that we need to look at. Because in the time of a difficulty, and the baby is crying, you don't know what to do, to get that advice at that moment and to resist somebody introducing a bottle, that's the kind of urgency we need. So whether this thing we can do with our midwives, we need to support them further, because that is what is expected, or because you can't really expect. But right now what is happening is, soon after coming from hospital, there is a difficulty, they would be going back for advice, and that's the critical point at which something gets introduced. And so these are the things that we need. I think a lot has been discussed, and
let me also add a few points. I'm also from the Labour Department. Actually, when we talk about labour laws, we follow ILO conventions. We have ratified ILO Convention 103 at the moment. We ratified it in 1993, but thereafter there's another convention from the ILO with advanced facilities, that is ILO Convention 183. But we are, as a developing country, we are not in a position to ratify that ILO Convention 183, because at the moment the law is actually employer liable mechanism. The employer has to bear the cost of maternity benefits. So the Ministry of Labour with the Department of Labour now has given thoughts for amending these laws, or at the moment there's a law amendment process going on. Still you have the time to forward if you have any sort of suggestions regarding uplifting these maternity benefits. And the other thing is that the Ministry of Labour has given the thoughts as Dr. I can't remember. Explained. It's a collective thing. So the Ministry of Labour has given thoughts and collecting information and data on how we can build up a social security network. For that, we need a initial funding, and the ministry is in the discussions with the ILO, and I think since it's a collective effort, our other ministries and other NGOs and the UN organizations too will support this, because you have understood the need of breastfeeding. So I think it's a very good
awareness program, and thanks for inviting Department of Labor as well for this forum.
Thank you very much for that feedback. Now you can see there's a bit of further opportunity in that direction. So it's important that we write and express and anyone else who has suggestions, because they are right now making some revisions and exploring how their legal framework should support the breastfeeding working mothers. So,
Madam, I have another small question here. I have MOMCH Candy. In estate sector, we have another problem because they don't take 84 days maternity leave. They go after 42 days, they go for work. So if we can do something for that, to prevent that, it's a big problem for us, I think.
The Department of
They give all the money to get certificates.
has introduced a complaint management system through the Department of Labor has introduced one complaint mechanism that you can forward a complaint. You can go to the website and the link is there. Or else you can call any of the labor officers, nearby labor officers, and inform if there's such a violation.
But what if the person wants to go back to work because of the money? If the mother wants to go back because she gets paid daily.
All two enactments, Maternity Benefits Ordinance and the Children Office, even the Establishment Code, they say that none of the females could be employed before 1 month. That's the legal provision. Then it would be a violation. Otherwise, that's.
No, and they get a lump sum at the beginning which they finish. Isn't it, doctor? They get 30,000. Then they go to another
school. In that point, you will need supportive systems and humanitarian changes that will come there.
Maybe we shouldn't give the lump sum.
That is what we have
Humanitarian has to be followed. I hope crossnotes are also taken down. I'm also putting something anyway.
අදකට complaints විතරක් කියන්නේ නැතුව complaint stroke suggestions කියන්න. නැත්නම් complaints very negative no.
No, that's a separate thing. The other one is no amendment thing is Department of Labor for not only for the maternity complaints, for all the complaints. For us to monitor the complaints and expedite.
We can continue during lunchtime, right? So we have come to a very interesting end, and I'm sure there's a concluding session. According to the agenda, so let us thank all the panelists for making a very stimulating discussion possible.
We had a very fruitful discussion.